I think one of the first things I was thinking about was when did it hit you? Like when we first met, you didn't have a bunch of health problems.
Right.
How old were you when you became a frequent flyer? And like what happened?
Well,
And by the way, forget you're on camera.
no, yeah.
Just
So,
talk.
yeah. So,
Normal person.
in answering those questions, you never really know when these things start, right? Like, about my kidney problem, but of all the things, part of the kidney problem is I'm not processing and retaining protein, which makes you hungry. And so for years, I thought I was hypoglycemic. As a kid, I just had to keep eating all the time. Well, did I really have a kidney problem back then? And
Wait, this started when you were a kid?
nobody can answer questions. And
But I mean, if the symptoms are there, right, you could say, I probably started when I was a kid.
right, but I didn't see the doctor and didn't, like, make 2 and 2. The other thing that would happen, I played basketball a lot. Love basketball. Uh, I'm 5'8", used to brag that, I could dunk a tennis ball, but, I would if we were playing full court basketball and we stopped abruptly for some reason, I would pass out.
What?
Yeah, I'd be on the ground, and so I went and did some tests, and they diagnosed me with hypotropic myocarditis, which was almost not ever diagnosed, but now it's kinda common. But fast forward 20 years later, I get in my first stent. I'm like, there's gotta be a connection to, like, the whole,
Yeah.
passing out in the heart. So, when the true diagnoses for, the colon, colorectal issues, for the heart issues, for the kidney issues, really probably kicked off about 16 years ago. And
You were a young whippersnapper 16 years ago.
yeah, yeah. And the whole conversation kind of, for me, and I say conversation a lot because I'm talking to myself about
Uh,
these things, of trying to wade through, 4 or 5 different types of doctors and trying to figure out, are these things connected? Are they not? Who do I listen to? But it started back then, and that's why I coined myself a frequent flyer. I've had some 15, 16 procedures, um, without any grand success, except for I'm still here.
that sounds pretty successful.
Yeah. So, um,
Okay, so 15, 16 procedures, mostly stents?
well, I got a whole bunch of stents, 6, I think. I gotta check with the wife sometimes, and maybe it's 7.
Yeah.
I've had 4 colorectal procedures trying to fix, really annoying problems that the only thing that maybe could have created it for me, because you always want to figure out, is it your fault, is that I didn't drink enough water. Like, maybe I've been chronically dehydrated. It causes problems down there. I had a bunch there, a couple on my knees, a couple on my feet. Then I had the kidney biopsies, and so I haven't really counted everything. I've had several
I didn't know you had any knee surgeries.
yeah, I tore my ACL skiing for the first time. I went with a friend of ours, and taught me how to ski. I was like, 40 pounds lighter, more athletic, really, really good shape, and I'm thinking I could do this, and so I took on a black diamond, and
You
I tore my ACL,
Well, where was this?
Breckenridge.
You went on a black diamond, like, 3 days after learning how to ski.
Yeah, that afternoon. Yeah.
Yeah, that's solid.
Okay, so, there you go, I'm not very smart. So,
Well,
but yeah, I tore my ACL and recreated a couple of different surgeries and so on and so forth. So I'm a frequent flyer. So, in our work and our business that, I've had the pleasure of working on with you over the years, is that I see things through the patient's eyes, whether it's about, pre-surgery, post-surgery, the bills, doctor communication, all the information. I'm very sympathetic. I can identify with a lot of these challenges, and the money part, right? Nothing's free, and
yep.
timing these things, and um, just the it's been an interesting journey, because when we sit down with patients, doctors, um, and employers, I feel like I fully identify.
Yeah. What like, out of this frequent flyer deal, you went to work at Zero Card, I can't remember when that was. 16, 17, 18, somewhere in there?
About 16, 17, yeah.
Yeah. So how did it help the team there that you understood the healthcare system? Perhaps not yet really from an employer perspective or a plan perspective, but really from a patient perspective,
Right.
which it seems like the tech bros and the MBAs really don't, like they have no clue.
Right. Right. Well, I going to zero card, you you deal with a lot of the fear and confusion around healthcare.
Yeah.
No matter what's going on, wait a minute, what's wrong with my rectum? What did I
Yeah,
do wrong?
yeah.
Or how much is this going to cost? Or am I going to be in pain forever? And zero card had a group of people, their care coordinators or their personal care coordinators. They just
Jim Milloway's wondering if we're going to talk badly about him right now.
yeah, I know. This
No, Jim, we'll skip that for today.
They had an amazing group of people who took care, right? Yeah. And then on my side, when I worked with them, I was kind of doing provider recruiting. So I was calling physicians and facilities, and I was explaining to them why our offering was so exciting.
Yeah.
Is that it was,
Dude, it was awesome.
yeah, it was.
It was awesome.
And so I felt like I'm in the middle of this. Wait a minute, I have to go have an MRI for some reason. Maybe I'll go do my own contract
Yeah, maybe do my own.
and do a,
That's right.
so it was pretty kind of cool, right? So it was fun to be a part of that.
What was one of your, like, you made some good friends at Zero.
Hmm.
Tell me a little bit about your experience learning from Dr. Schwartz, because he's a guy I really like.
Yeah, so Dr. Schwartz is a pretty amazing guy, and one of the leaders in this thought world that we're in around price transparency. He led our local hospitals for years, and just really understanding how pricing is built. You've been an amazing in helping me, but he helped continue to develop those things of how pricing and how doctors think and what's
Yeah.
important to them. And what's the challenges in the community, and what is really going on there? And so he was very helpful, and he was also like really kind of pragmatic. Like I personally can tend to be black and white about things, and he would be like, "Well, did you think about this?" So Dr. Schwartz was just a lot of depth and a lot of maturity when it came.
Was that the first time you, like, worked in healthcare, if you will?
If you want, yeah, officially in the middle of it, yeah.
Yeah.
I've been probably in and around it before that.
Well, you were definitely in it,
Yeah.
getting 16, 17 procedures.
Yeah. Now you're gonna make me want to go count. Really, how many are there?
Well,
There's
like, now I got to figure it out because I remembered the 6 stents, but I didn't remember anything else.
yeah,
I didn't remember the knee surgeries for sure.
knee, ankles, whatever. Yeah, it's just
Savos Health, the largest cash pay marketplace for affordable Medicare, from imaging and surgeries to labs and beyond. Savos Health simplifies healthcare by offering real-time bundled pricing, quick scheduling, and guaranteed immediate cash payment for patients, payers, and physicians. Whether you're a self-pay patient, part of a health-sharing ministry, or self-funded employer, Savos makes high-quality healthcare accessible and straightforward. Visit savos.com to learn more and discover a better way to pay for your healthcare. Savos Health, your go-to cash pay marketplace for affordable and transparent medical services. They sponsor this episode. With options for imaging, outpatient surgery, labs, and more, Savos simplifies healthcare with real-time bundled pricing and immediate cash payments. It's designed for self-pay patients, health-sharing groups, and self-funded employers who need affordable and accessible care. For a new healthcare payment method, check out Savos Health's website at savos.com. Savos Health is today's sponsor, bringing you the largest marketplace of affordable cash prices for medical care such as imaging, labs, and procedures. Savos Connect makes it easy for patients and physicians to offer bundled pricing, simple scheduling, and immediate cash payment. It's perfect for anyone looking to cut out traditional networks and pay directly. Visit Savos Health's website at savos.com and discover how cash pay can transform your healthcare experience.
What like, what are patients missing? I keep thinking about the patient journey. What are patients missing that you see that you're like, "Hey, here's if you could do these things, this would be really helpful."
Yeah, I think, if you think about some of the moments that come up in healthcare and some of the needs that you have, some of the medical needs, Johnny gets hurt on the ball field on the weekend, or, I've got this growth,
Yeah,
I got to go figure it out. You really don't want to be making decisions at that moment. You want to kind of be prepared,
yeah,
and you want to get to know your benefit plan. You want to get to know what your rights and what your opportunities are beforehand, because when those moments come, you're going to have an element of fear. Everyone has some element of fear, no matter
sure.
what they say. And then there's also an element of like physical discomfort, right? I feel this
Yeah,
itchy
this hurts.
pain. I can't sleep. I can't wake up, right? So there's those two things will distort really good decision making,
Yeah.
right? If you are about to buy a house, and do you really like, you want to feel good about buying that house. You don't want to be afraid and just have broken your ankle,
No.
right? So I would encourage folks like the patients to like get to know your benefits beforehand. And and then the other part is we talk about this frequently on those who are building benefit stacks, is the proper care navigation. It's really hard. It's really hard because sometimes you deal with just an app, or sometimes you deal with someone on the phone who might be the greatest person in the world but doesn't know jack about medical. And then there are some cases you can get an actual doctor on the phone, which
Yeah,
I think is pretty bombastic and helpful in a lot of ways.
yeah,
So I just really feel like, get to know what you have available and ask a lot of questions before you need to. I always tell folks, you want to go get your home equity loan or your car loan when you don't need it, because you'll get the best rates.
yeah,
You don't want to be desperate and need a home equity loan so you can fix your car or something, or desperate so that you can get an auto loan and so you can get to work. You don't want to make those decisions when you're desperate, because you're going to get screwed over.
yeah, then it becomes a problem.
Right.
Then it becomes a problem. So recently, you got your PNC license.
Yeah.
Did you ever think
No.
that you'd be back to this nasty business?
No, I was, licensed in CFP, Series 7 insurances and all this
Yeah.
stuff, and I just didn't wanna go back, and it was, almost all exclusively individual financial planning, and I left that because I didn't like it. Um, and
It
coming
wasn't that you were terrible at it. It was
No,
you didn't like it.
no, I collected a $500 million investable assets in 12 years, but I hated every minute of it.
Yeah.
I read the prospectuses of these products, and, well, we won't go down that rabbit trail, but I'd rather manage my own money, right? Rather handle my own portfolio. But we started serving, physicians and facilities in January, and we ended up falling into, hey, we know what the answers are, and we know how to help folks, and we end up getting licensed in these
Yeah.
different insurance. And here, wait a minute, I'm P&C. I don't want to go sell auto, home, and it's more than that, as you know. But yeah, just really surprised that, oh, this is where I landed. And then the whole world starts opening up. You start thinking quite differently as you
Yeah.
learn about that business, right?
Yeah.
So,
What is unique from a healthcare perspective when you're talking about property? What is it that people don't yet understand in ways that you're kind of driving value? Like on LinkedIn and X, where you and I have spent a great deal of time, in doctors' offices, we spent a great deal of time, and we usually talk about employee benefits.
right,
And then a few years ago, we really started hammering workers' compensation because everybody says, well, benefits, benefits, benefits. But I'm like, but what about all the injured workers?
right,
Right. And then you and I kind of did another leap and said, wow, well, what about the building itself? And, what about all the risks associated with the things inside this building? And how does it work? And if the goal is really to help physicians stay in private practice and build long legacy businesses, what's kind of the PNC angle or what's the property angle that you found? Because I found your insights to be
Yeah, so
somewhat surprising.
I
Now the audience doesn't know that we've known each other forever.
we talk about these things.
They'll figure it out, but
Well, I feel like when you speak to the physician-owned hospitals and the physician-owned practices that, the actual physical property of it, um, they see the value of it, and it's a part of their investment portfolio. But when you start going into the insuring, the risk management part of it,
Yeah.
they get really annoyed because they have to have certain kind of coverages. They have to have malpractice. They have to have these things that they're mandated. And so in most situations like this, when something's mandated, what's being sold to you feels like a commodity and you have no control over it, right?
yeah,
And so the conversation we're having with the folks is helping them understand that there's a true opportunity here. There's an opportunity to use these products to build additional assets, to continue to fortify your position in your property, so that when you are ready to have an exit, you're prepared, and so that you're just not checking the box, so to speak. And so, and that industry, as we were talking uh, to a client the other day, that industry is pretty much going upside down in a lot of ways. You have major, massive claims in medical malpractices, for good or bad or whatever reason. But those claims, those awards were never happening before, and now they are.
that's right.
And another problem that you're having is that you have assets that have exploded in value. So if you have an ASC that's worth, $20 million,
Yeah,
and 3 years later it's now worth 75, the insurance company hasn't collected enough to cover a claim of $70 million.
that's right.
The financial arbitrage is not in the favor of these groups. Plus, you have a lot of mismanagement, a lot of bad Wall Street decisions. Insurance companies are supposed to be conservative and consistent. Wall Street will kind of tend to make those groups make bad decisions that at the end of the day, what you have is you have property, casualty, liability type insurance companies exiting the market.
Yep.
They just can't survive here anymore because of these decisions. So,
What kind of decisions were they making that led them not to like, if you and I are looking now, we'd say those were not conservative decisions.
well, in 1980, average dollar spent on advertising by insurance industry overall was 1.2%. We're at 6 to 8% of the dollars spent on advertising. That doesn't sound like a lot, but that's a
So it's a
800% growth
yeah,
on a line item that doesn't make sense. So the other thing is that, they're constantly price fighting for premium because that's how they make their money, and not saying no to things. So if you don't price your premiums properly because you want to get the business and get market share, but you're doing so refusing to recognize that property is going up at 2.5%, 2.5 times what other properties are going up, you're hurting yourself. But you're doing it so you can have the revenue in the door and your P&L looks well.
yeah,
All of these things create an opportunity for doctors to think and to really put their dollars to work in the right way.
yeah,
And I feel like we're in a grand super cycle. You hear a lot of that when you talk about oil and gas and different things like that. We're in a grand super cycle on commercial insurances. Their commercial insurances, since we're going down this rabbit hole, is this that they are maturing. If you look at benefits has become very mature. The transition from transactional to advisory. Well, the transaction or the movement from transaction to advisory in commercial lines, property and casualty is just starting. And so,
and what does that mean?
well, it actually means going from, like, for specific reasons, it means going from a fully insured benefit plan
Yep,
to a self-insured benefit plan.
yeah,
And then taking you and other self-insureds and putting together in a captive and completely removing the overhead junk of an insurance carrier.
yeah.
That transition,
So you're essentially moving from, hey, I'm working with a carrier,
right?
to I'm going to be my own health insurance company, or I'm going to be my own insurance company, and I'm going to manage my risk.
Yes, and so what's happening is in the P&C world, that's
I could just hear the doctors now going,
yes.
they're freaking out.
Yes. Well, Lloyd's of London helps us prepare for the moment when there's really bad situations. If you understand reinsurance, stop loss, general hedging, you can really make those transitions very nicely.
Yeah.
And it's for the benefit of the doctors that their dollars are being spent properly. And you don't really, just in general, in the line item of insurance, if you combine benefits, property, casualty, liability, you're getting to some of the highest line item expenses for a business. It wasn't like that 20 years ago.
No, the other day when you and I looked at it, I think there were like 16 or 18 items.
It's crazy.
I just kept reading and I'm like, wait a minute. Like, you have to pay all of this?
Yeah.
Cyber insurance, business continuity, errors and omissions, malpractice, key man. Oh, then you got retirement.
Yeah.
I'm like, when does the list end?
It-
Like, how about will you generate some revenue for me?
Yeah.
But no, you're just costing me money.
Right.
These are just expense items.
Right. And so when the carriers go and they price those things, they price the premium, they're looking at the entire market. But you as a doctor, you know who you are and how you take care of your property and how you take care of your patients and how often you get sued. Well, every dollar that you put towards insurance in the past has been gone.
Yep.
Well, what if 20% of that dollar was actually became an asset for you?
That's right.
And then the next year, maybe 5% went over here and became an asset. And then you get the growth of that. 25% becomes 27%, leaning against the dollar that you're trying to insure. It's just the proper financial instrument that, and technology is helping, right? Because there are a lot of, there's a lot of administration to this type of thinking, moving away from transactional to fee to a captive type environment where you're your own carrier, so to speak. And technology has really helped because there's the underwriting that is very difficult, actuarial work that's very difficult. But we're in a world where someone can take a picture of my forearm and tell me if I have cancer. Well, we could do things.
Yeah.
The computer really helps us out.
Tell me a little bit about, you're working on a project called a physician-owned managed services organization. And then you've got a couple of others. I don't know if you want to talk about those today, but tell me how benefits P&C kind of work within that structure, and why'd you come up with the idea? Like, where did it come from?
Well, it's just the pain points that we hear out there. So if you're really just talking about malpractice or really any kind of insurance, it's better to have 100,000 doctors in a room and pooling those dollars. That's what insurance is doing, rather than just you as a 2-man shop or even you as a 50-man shop.
Yeah.
So creating an organization where these groups can kind of pool their resources and pool their risk, that financial instrument we were talking about becomes much better. The balance sheet gets better. And so what we're doing is we're creating an environment where doctors can make that transition from just paying a premium to building their own kind of plan and insuring themselves, to let's do it with others. And let's all put them into the room and the pricing gets better.
Yeah.
And so we're starting to, when we look at that type of environment, we're taking problems off the doctors. Like the doctor, like legitimately could go out and build a windmill in their backyard and generate his own electricity and build the entire battery source. A doctor could figure that out.
Yeah.
But he would rather just plug it in.
Yeah.
Right? And he would rather have high quality, consistent flow of electricity. Well, the same thing is just really wants to have an environment where they're not throwing money out the window, but they can trust it. It's an easy button, right? So it doesn't need to be rocket science. And the organization that we're building isn't. It's, we're going to provide these services and we're going to reduce the expenses. We're going to reduce your risk. We're going to build an asset. You're going to have control, and it makes it available it really plays into the overarching message that you've been preaching for a long time, and that I've been a part of here in the last few years, is physician autonomy.
Yep.
Because if they do those things, they don't have to worry, and the dollar that they earn in revenue goes much further, and it just really helps them out.
A lot of people are probably kind of scratching their heads going like, well, you can't build an association plan, Chuck. Grouping people together doesn't work. I hear that pretty regularly. Why were we able to make it work?
I think it's because we are truly focused on the delivery of healthcare.
Yeah.
There's a lot of specialty specific data points, a part of this process that we truly understand. Between us, we have a ton of experience on the sell side and the buy side of the business. And so when we sit down with a physician and a facility group, we're able to help them walk through this process and understand that this type of organization that we've put together will work. And why, and so go through the process of why. And we're checking the regulatory boxes. Everyone's for each state, medical malpractice. There's states that have different rules. Liability and workers' comp for each state has different rules.
Every state has different rules.
But that's why we've partnered with world-class partners that are able to take a look at this and can handle these things very easily.
Yeah.
But again, create an easy button for the workers' comp for all these different insurances,
Yeah.
so that they can feel trustworthy. And then when you go to a doctor, you can offer all these things. And we offer a full portfolio of revenue building opportunities. It's good to not present it to a physician as all or nothing.
Yeah.
Like, nobody likes to be backed into a corner.
No.
So if a doctor feels comfortable moving his benefits over and his medical malpractice and workers' comp, but he doesn't really want to move over his property and slip and fall insurance, and he wants to keep it with the guy he goes to church with, let's create a flexible environment for him so that he's not feel like it's all or nothing. We'll win the business long term.
Yeah.
Right? Because we'll execute and we'll perform. But create an environment that doctors can have choices rather than less choices.
Yeah.
Which is part of what we preach all the time.
For sure. Tell me a little bit about, we're going to go back in time because the audience doesn't know you very well. They're sick of me. Tell me about when you and I first met, I don't know, almost 25 years ago.
Mm-hmm.
You'd been a missionary in Paraguay.
Mm-hmm.
How did that, one, how did you even decide I'm going to, spend 2 years or a year in some foreign country? And then how did it help you really understand, how does it help you have empathy for the patients that you help today, and even the employers and the physicians that we deal with at large?
So everyone kind of goes about life decisions differently, and I feel like there's not really two different people, but there are some people, like physicians, that by the time they're 16, they've decided, I'm going to be a physician. I'm going to get all A's. I'm going to go to college. I'm going to get all A's. I'm going to become a physician. They make that early on decision. That's not what happened with me when it comes to being a missionary to South America. I was going to the University of Pittsburgh. I was studying. Some friends were part of a group and went on a short-term mission trip. So, I can do 2 weeks. And what we did is we did some work with the kids, and we did some work with medical.
Yeah.
We brought some nurses down and some doctors down and started, doing that. And after that experience, I was like, oh, this is really cool. So through college, I did it a bunch of times. And after college, the same group I worked with invited me to come down on a full-time experience in Paraguay, South America. And it was like, okay, well, this makes sense. I'll go do this for a couple years.
Yeah.
And so it just kind of was an evolutionary type decision. Like, I didn't put when I was 16, I'm going to be a missionary.
Yeah.
That didn't happen to me, but that's just how things happen. And some people are like that, right?
Yeah.
Um,
You loved it.
yeah, and it's like, this is fun. I love people. I love all kinds of people.
Yeah.
I love all kinds of food. I love to eat, right?
Yeah.
So you go to the different countries, and they make their steak different, or they make their potatoes different, or there's different type of potatoes. Like, I just ate that up, right? So my experience down there was wonderful. Like the mission trips and the actual full-time mission there, I was a little over 2 years, was absolutely wonderful from just a personal call. I had so much fun. It was
Yeah.
totally enjoyable. And I think just like anyone who spends any time overseas, which I recommend it to everyone, whether it's missions, military, or vacation, um, you get a different perspective. Like, hey, we're all kind of like the same. People like have families, they enjoy food, they want their kids to do well, they like safety. Like, we're all kind of the same.
We're all kind of the same,
Yeah,
right?
like
Yeah.
humans, like so. And then you also get a perspective about how wonderful we have it in the United States. Now, I believe we have a lot to work on, but we're so blessed here, and it's just off the charts. And so when you go live in South America, and Paraguay's a third world country, but they do well.
Yeah.
I spent a lot of time.
Where in Paraguay were you?
It was in Asuncion. So
Is that a major city?
that's their biggest city. That's their capital. A lot of time in Ciudad del Este, which is on the border of Brazil. And then my group spent a lot of time in Brazil. The southern cone of Brazil, we were all over from, between Curitiba and Belo Horizonte and all these. Well, that's down in Argentina. But, what am I thinking? But with just a great experience of traveling around there.
All right, so what's your do you like Brazilian food better, Argentinian food, Paraguayan food? Like, what's really like
That won't cause a war, but it would cause a war with a lot of people because it's important.
oh, they take their food seriously. Not like here.
I think I would say the Brazil.
Yeah.
They're the ones that I know, like an asado is
Yes.
attractive. And we know here as the Fogo de Chaus or the Brazilian steakhouses, that's, I lived in one of the hottest climates in the world, and I magically gained 20 pounds over 2 years. And it was because the food was wonderful and inexpensive.
What's like the basic breakdown of the food? Is it like beans, rice?
No.
Like breads? Like, what is it?
Breads, meats,
Yeah.
really good beef, empanadas, a lot of like fried foods and different things like
So
that.
good.
Oh, the panaderia was just like, I would go there daily.
Oh,
I could just smell it.
I remember. So two things. One, I lived in the Azores, and then I spent a bunch of time in Guyana and down in the jungle. And I thought, this food can't get any better. Like, these people are poor. They have nothing. Yet in the mornings for about 5 cents US equivalent, I'm getting freshly made bread. I'm getting fresh breakfast. And it's just like, wow. And so, it's off the chain.
And
Oh, and the coffee is black.
yes,
Like, it's real coffee.
yes. And like we deal with today,
Yeah.
that food was 10 times healthier than what we're eating today.
Dude, like, look, we're giggling as old guys. We're like giggling about food that we had 25 years ago.
Yeah.
Because it's just so heartwarming. And like, you can remember the taste and you're just like, oh my God, that was so good. And it only cost me 4 cents. Oh my God.
Yeah.
Yeah.
Those were the days.
Have you ever thought about taking the fam with you?
Yeah, we have.
You think you'll do it before the kids are like 25?
No, we have some mission trips coming up. Because of my heart and because of my kidney and because of the various different things, a mission trip's probably not the smartest thing for me to do right now.
No, I'm saying before the kids are 25. That's a minute from now.
Yeah, but my wife is actually looking to go on one with
Oh,
my
really?
youngest, and my oldest is going on one with the team here in a few weeks, and so they're doing it. I'm not, unfortunately, getting to experience it with them.
So I was also thinking about going down to Paraguay.
Like take them more.
Yeah.
I have
Would you
thought
take
about
the
that.
kids to Brazil? Would you take them to Paraguay?
100%.
Yeah.
100%. And because of what's going on in Argentina, you're darn sure we're going down to Buenos Aires.
Dude, you loved that Melee interview with Lex Friedman, didn't you?
Yes, it was amazing. Like, I'm an economic junkie. Like, when I went to school, I did business and statistics, but I loved my econ classes.
Yeah.
I tell people, like, there's like God, our creator and savior is up here. Like, right below it is the supply and demand curve. I mean,
Yeah.
I just love economics,
Yeah.
right? And so listening to the work that he's done there and how quickly it's changed and turned around. And Argentina is just wonderful. I'm thinking, all these things work.
Oh, yeah. The free market works.
Yeah.
How about that?
Yeah, free market.
Speaking of that, how has price transparency helped you as a patient? Like, like, I mean, we've talked about this for a dozen years. Like, does having a price transparent lab network help you?
Yeah.
I mean, you get you get labs all the time.
Oh, I'm a frequent flyer of the lab world. They know me.
Yeah, that's right.
You know what's funny about
Not
that?
know me,
Yeah.
but they do know you.
They know me. You know what's funny about the whole, I don't know if I ever told you
That's
this.
another one we won't talk about today, huh?
We'll talk about whatever you want, but so I have been stuck like 9 gazillion times, right?
Yeah.
And so they always have a hard time finding my vein or whatever, and it would just drive me nuts. Well, I'm at a nephrologist right now, and the lady there that what's it called, that does the phlebotomist,
Yeah.
is just like, she figured it out immediately. She goes, "Well, it's because your veins go this way and they don't go that way like everyone else." And I'm like, I'm cussing in my head because I've been stabbed 5,000 times.
That's right.
Unnecessarily. This young lady gets it like bang. So
Well trained.
yes, so everywhere I go. But yeah, the price transparency is incredible. So if you're on a traditional employer plan, Blue Cross, United, or whatever, you've got a copay, 80 or a deductible and a copay, and you've got an out of pocket.
Yeah.
And if it's a high deductible, we like to call it the FUs, the functionally uninsured. A lot of folks, if you have a $5,000 deductible and you've got $1,000 in the bank, you're not insured.
That's right.
That's just mathematically, that's what's happening. But if you have a deductible, let's call it $3,000, and I need to go have an MRI. Okay. So the knee doctor sends me down to the local hospital MRI, and I call ahead, and it's going to be out of pocket 35. The whole total enchilada is $3,500. I'm going to be out of pocket $1,700.
Yeah.
For an MRI of of my knee, and that's my money. That's $1,700. That's my money.
Right. Could go to your kids.
Yeah.
Could go to your wife. It could go to your house.
I can go.
Could go to your cars. We can smoke some cigars. We smoke a lot of cigars for $1,700.
Yeah. So, like, you take a look at that and learning this process and having my eyes opened here, you can call down the street to the private physician-owned group, and they're going to charge you $500 total. So the insurance company, you're going to have $40 out of pocket compared to $1,700.
Yeah.
And it's just a really, okay, so I'm the type of person who has, like, I get a little rage, like, what the, what is going on here?
Yeah.
So yes, it is incredibly important, the price transparency, because if you could ignore it, just like we talked about earlier when we talk about patients, when you come to the money part of your care, if you're prepared, you'll make good decisions. And that's one of those things, like, okay, my knee is blown up because I screwed up and decided to take the black diamonds on my first day skiing, right? And I got to have an MRI. Do I pay full price, or do I go get the $500 one? And okay, so a lot of times when you talk about these numbers, the next thing a smart person will say is about quality. Let me assure you, the quality at the private location of that MRI is going to be much better than the one in the basement at the hospital.
Yeah.
That's just, and that is probably true for a lot of.
So I found something interesting about that is the pushback that we've gotten over the last 10 or 15 years is, well, it doesn't go towards my deductible,
Yeah.
And so there's a couple things there that I really dislike. One is 90% of all plan members never even meet their deductible.
Correct.
Right? They don't get close to their deductible, and they sure as shit don't get close to their out-of-pocket max.
And Kaiser's
It's not happening.
Yeah, Kaiser's been telling us that for years.
And then number two, some really good friends of ours who actually do real policy work, unlike many in Washington. I should say like 99% of the policy wonks are absolute idiots. The thing that I love is the really good, knowledgeable policy people in Texas and in Tennessee made it and created a new law that went into pass in the last 18 months in both states, where if you're out of network, so say you go to an independent radiologist and you pay cash, that has to go towards your deductible.
Right.
And so they've created a process where you turn that in.
Right.
And so when do you think that's going to go? Like, when do you think the rest of the states are going to start adopting that?
I don't know. That's a political question for each state, but I hope it rolls up really fast and takes effect. Back to this MRI of the knee. I remember having this fight.
Yeah.
The location I went to here in town is called Envision Imaging.
Oh, we love Envision.
They're,
EN.
yeah, $275 for a CT.
Yeah.
$500 for an MRI. So my insurance, this is like, it was 20 some years ago when this was happening, but my insurance company would not accept the dollars I spent as to go towards my deductible. And I'm like, I always tell folks, like, I can be one of the most annoying people in the world. So I just keep calling back.
I can assure them of that.
I just keep calling back and calling back.
Yeah.
And so they wouldn't accept it because it was considered out of network, which was not true because they're actually in network.
Yeah, they're actually in network.
So I won that situation by simply like driving them nuts and referring them to the Department of Health and whoever I thought could care at that moment. But like they finally relented and it went towards my accumulators, as the industry calls them, towards my deductible. And so, I just learned what you just shared about Texas and Tennessee, that those plans have to accept those dollars towards a deductible. That is a gigantic win.
It's a huge win.
So I think it could really take hold. You got leaders and governors like our state, for good or bad, but on subjects like this, they're going to take a look at it and say, oh, we'll do it here in Oklahoma.
Today's sponsor is the MJ Companies, a leader in data-driven, client-focused solutions for private practices and physician-owned hospitals. MJ believes in using data to create a personalized approach for every client. They reduce expenses through employee benefits featuring domestic networks and captive solutions. And they offer unmatched property and casualty coverage for added security. MJ's commitment to growth is just as strong. They help build direct networks that improve patient intake and create steady income through PPM fees, fee-for-service, and capitated payments. Their dashboard allows practices to track referrals, identify patterns, and optimize efficiencies. The MJ is more than just an insurance provider. They are a strategic partner in your success. Learn more about their tailored solutions at themjcompanies.com.
Yeah, I have to say, because I think, guys like Keith Smith, Dr. Keith Smith, I guess, they were first.
Right.
You know what I mean? They're the OGs. I give them a lot of respect. But having lived here now, I guess 3 years, four, yeah, it's 4 in October. I remain disappointed. I went to school with the lieutenant governor, and then the governor, apparently great guy, right? I don't know him from a hole in the wall. I hear great things about him, but most states, including this one, like they don't pay attention to healthcare.
No.
But it's like, if you look at the line item budget for the state of Oklahoma, or my favorite state, the state of Arizona, you see that in the top 5, 2 of them are healthcare related. And yet these governors don't know anything.
They just look
And
away.
when you talk to the policy people, which I've done several times here in Oklahoma, you're like, did the word idiot? Like, what? Where are you guys from? Are you from Mars? And it's not Elon's Mars, because his Mars is smart.
He's been there. Yeah.
Yeah. I'm like, you guys are dumb.
Yeah.
And it's just, I don't get it, right?
Yeah.
Because I'm like, you have really smart people in this state, not me. But you got others. I just mentioned Keith. I mean, you have a really great group. We had the podcast with Dr. Jamie Cash. Right. And there are people in this state that are so far ahead when it comes to how to finance healthcare. It's not even funny.
Right.
And yet the leaders have no idea.
Oh, yeah.
You talk to them, you're like, but aren't you the attorney general? Like, shouldn't you know a little bit about this? Like, question mark?
Yeah.
Like, no, zero, nothing.
Yeah, you said that, I always think of the song from Pink Floyd, The Turning Away. I think people they look at this subject, they get confused or whatever, and they just, let's go do oil and gas, because that's what we've always done. And oil and gas is a wonderful industry, and that's what we're known for. But I wish we would be Sooners in the conversation of healthcare, because this state, as you said,
You just had to throw that OU crap in there.
Yeah, the Sooners, boomer. So, we are amazing at delivering and financing healthcare. You talked about the finance side, Keith Smith, but like on the delivery side, some of our hospitals are the most innovative hospitals in the nation.
Yeah.
And, the one, my frequent flyer is, Oklahoma Surgical Hospital. Amazing, comfortable, great doctors, great outcome, 5-star this, top shelf that, and no one ever talks about them.
Yeah, I've never understood it. I don't know. I mean, I know some of the docs over there. As you know, I don't really try to partake in my local community. I've never understood why the entire country doesn't love Oklahoma Surgical Hospital. Like, they do 20,000 cases. Like, I've lived in New York City, lived there a long time, as you know, lived in San Francisco, shithole, for 2 years, but I wish it was better. I think it's getting better,
Eh.
but that's a different topic. But, like, the smart, innovative people I've met in both of those cities,
Mm-hmm.
I tell them, like, you must come to Oklahoma and you must study Oklahoma Surgical Hospital.
100%.
And they're like, what? Flyover country? And I'm like, you guys
Yeah.
are dingbats.
Yeah.
You can get a total joint here by literally a top 10 surgeon in the country for nothing.
Right.
Oh, but I'd rather have it at NYU Langone or HHS. Woo!
Yeah.
Let me tell you what I think about that.
Well, ask
Garbage.
how many times has Senator Langford, and all his national travels and all his work in D.C., how many times has Senator Langford talked about Oklahoma Surgical Hospital?
0 times.
Which is appalling.
Now, to be fair to him, because he did sponsor the bill on physician-owned hospitals.
Right.
But here's the thing, man. I grab all of these. I did a poll with the Doc Caucus last year when I was in D.C., and I asked, well, like, how many of you have been to physician-owned hospital? Like, I'm sorry, what?
Yeah.
One of the things PHA is doing next year is, so next year's like a month from now, is they're literally touring every single surgical hospital that's physician-owned and acute care hospital that's physician-owned or physician partners. Like, there are fantastic ones in the country. Like, I regularly complain about Baylor Scott & White, but I am the biggest fan of the heart hospital at Baylor Scott & White because it's physician-led, physician-owned, and physician-driven.
100%.
Same way in Indianapolis.
So Oklahoma oil and gas industry spent some money with Mike Rowe,
Oh, yeah.
dirty job guy, and
I love him.
there's been a 3 or 4, maybe 5-year marketing work that
Yeah.
he's done of telling the story of the oil and gas industry in Oklahoma. It's been great.
Yeah.
We need something like that because you could spend a year talking about.
We're going to have to get Jeff to do that with us.
Yes, that sounds like
Yeah,
a great
Jeff.
idea.
Let's do that.
Yeah. I mean, really, and we have an amazing group of people in this state that do act like Sooners.
Yeah.
That we're going to run across the frickin' field and we're going to win.
I mean, I've never understood it. I don't get why employers in large cities don't send their patients here. Right? I mean, I get it. Like, once we got into it, I understood it.
Right.
But if I was a large business on the coast, I would highly encourage my benefit plan member. Like, people don't realize that they are their own benefit plan. Like, when you're in a self-funded environment, you work for Salesforce, right? One of my favorite companies. When you work for sales, you work like it's your health benefit plan. You are the insurance company. They'll say something like, a member will say, well, they denied my, and I'm like, no, it's not they, it's you.
Your employer.
You denied your own.
Yeah.
Like, go see your HR department and go tell them you want this changed.
Yes.
Tell them you're tired of pre-authorizations. But here's the point. Like, I would take all of these really smart big companies, and why wouldn't you bring people here? I said the same thing in Arizona. The governor at the time, really no clue. He had to explain what elective procedures were to that guy. But I'm sure he's a decent dude, but whatever. They just don't, like, my big gripe is governors at large don't know healthcare.
No.
Right? Like, if you ask all the governors at the Governor's Council in DC, show of hands, who's ever heard of certificate of need? 34 hands are not going up. Like, those clowns have never understood certificate of need, and they're happy to have it. They're, they want the money from the health systems.
One of the greatest restrictions of the supply of healthcare is the certificate of need,
100%.
and they don't know about it.
And they don't know about it. And that's the thing. Like, states like Oklahoma, Arizona that don't have certificate of need, I would absolutely pounce on that.
Yeah.
if I'm
Opportunity.
Texas and I'm
Opportunity.
Dallas, you know, one of the fastest growing cities in the country, I would absolutely be like, hey, 34 of you plus DC, all of you pay higher premiums. Here's the data. You pay 20% higher premiums because in those states that you live in, they don't allow competition.
Right.
Like, how is this hard?
Yeah. And it's just work. You went back, you were talking about the laws that were changed in Texas and Tennessee.
Yeah.
I think as people begin to learn, um, I think there's two things to change the
Yeah.
system. One is what you talk about quite a bit on the doctor side. The doctors need to quit fighting each other, and they need to get together, and they need to, like you said, realtors get great tax advantages on their products and services because they spend billions in Washington, D.C. That's just a fact of the
I
matter.
mean, isn't that amazing when we said that on, I have to, I got to stop calling it Twitter because it's not Twitter, it's X. On X, we said that. And I mean, I think there were like 12,000 people that hit the heart button and were like, that's true.
Yeah.
Yeah.
They got to get in the game.
Yeah.
But on the other side is when we talk about price transparency and some of the other work that we're doing direct to patient is patients need to take some responsibility and be consumers.
Why do you
When
think people are afraid to say that to patients? Because I say it to them all the time, like, hey, how about you read? How about you take some responsibility?
I think it goes back to not being prepared. They're in the middle of being afraid and they're in pain.
Yep.
And we all make bad decisions when we're in those situations.
Yeah.
And so people just need to get active and actually, hey, you can go get your cholesterol checked for $15 instead of $250. You can do that. There's no emergency going on. There's probably no, or urgent or emergent situation. You can so start with the little things.
Yep.
Yes, like if you have an emergency appendectomy, go get it done. You're not going to be able to make good decisions in that moment. But like for the little things, for physical therapy, think a little bit, shop a little bit. It's different. Getting physical therapy at a private location versus the hospital institution is a 2 or 3x difference.
You and I had that scenario in Indiana recently. IU, right, which is beloved by all Hoosiers because they're all idiots. Just kidding. I'm just kidding.
Good football team this year.
Great football.
Google me.
No, I love Indiana. I have such a big heart for that city. One of my favorite cigar shops. But IU had, like, an employer was paying them $312 for claims on PT. And like literally down the street, you had several dozen PT clinics, independent PTs. I called a friend and I was like, all right, who's really good? Right? They ran a little analysis for us and it was like, well, and these are $95 to $100 a piece. It's like, why are we paying $300 when we could pay? And it's just like, it's just a little bit of work. I sometimes I get a little pessimistic because I think I'm the eternal optimist when I do things like, or I hear things like doctors will genuinely say, I don't have time. And I hear that from families, right? They go, Dutch, I'm working, I'm trying to make ends meet, all of which we all understand,
Right.
especially in the last 4 years. And now all of a sudden we're saying, hey, you've got a little bit more responsibility. What I would say is, hey, when they do a benefits meeting on November 15th, instead of playing on your phone, pay attention.
Yeah. Open enrollment's an opportunity.
I mean, you and I have done, I don't know how many open enrollment, thousands.
No one likes them. They're boring.
No one likes them. I try to make them fun when I used to do them. But I'm like, hey, just pay attention. Because no one thinks about healthcare until they need to think about it. And I think your advice is so good.
Right.
It's like, be prepared.
Yeah.
Do you have a little kit in your car in case your kid gets hurt? Well, every mom has a first aid kit in their car. Like every mom.
Huh.
I'm always like, hey, babe, the baby did blah, blah. And she's like, oh,
Here we
like,
go.
oh man, she's like, wow.
Done.
Yeah. Which I'm like, holy crap, I didn't think about any of those things.
And we'd all die.
I have healthcare covered, but I don't like, So yes, I think
it's like, what was it? 1997, Dr. Keith Smith was the first to start doing this.
Yeah.
And then product and companies came out 15, 20 years later, whatever, how long that's been, 30. Anyway, my math isn't great. We have 150 groups providing information to employers or opportunities to employers to save money, to transparent. I feel like we're getting there.
Yeah.
And I wonder where the pushback will begin. Will it
Yep.
come from the carriers? I don't know. They're really into PBMs and, Medicare right now. So
Well, they love Med Advantage and they love
yeah. So
PPM.
I don't know if the real pushback's going to come from the bukas, or what are we calling?
So I think let's talk about that a little bit, because I think that's an interesting conversation. When we saw our friends at now Marathon Health, Crossover, Care ATC, and a couple of others, when they came into market, the carriers pushed back, and then the employer said, no, this is what we're doing. And eventually, like, it just merged nicely in,
Right.
right? When I started our first direct-to-employer direct contracting company, there were 5 or 6, and there's some OGs, like Bridge Health, now Transparent, was, um, Surgery Plus, now called Lantern. Karam started about 3 or 4 years after I did. You've got a bunch of great solutions, as you said. I think we counted, it was, like, close to 150.
Right.
So that's a big difference from 5 or 8,
Right.
or consultants and brokers kind of doing their own thing in their own communities. And now all of a sudden, you're seeing less pushback.
Right.
I mean, for our benefit stack that you and I worked on along with our team, the carriers are integrating it. Like, we don't even have to do bundles anymore. Now, I like knowing the price, and we still want to present the prices,
Right.
but on the physician side. So you think that carrier that we have a deal with, that's a one-off, or do you think more carriers will begin to do it because they know that employers want it, and they don't really care about self-funding? Like, they don't make any money on self-funding anyway.
Yeah, I think that some of those assumptions are probably correct, that more and more will take up. And I think more and more of them are going to the model where they're making money on the like I said, the PBM, but look,
Yeah.
I mean, they'll charge $65 for a network per employee per month. That's where they're going to make the money. So we'll sell you the network, the employer. You can go do we don't really care where you do care.
yeah.
We're getting paid up front.
Yeah, we're getting a PPM. Sure.
And we're getting paid up front. We're getting subscription money instead of claims money, which is something we try to teach doctors.
Yep.
So I feel like the carriers are really not going to care.
Yeah.
They're going to be completely okay with it. Well, not completely, but I think they're just not going to battle it. And
Why would you? Why would you battle it? I try to think, like, if I'm sitting at the top of that heap, right? I'm running United Healthcare. I mean, I never would, because I don't want to go to hell. I mean, it's true. I don't care. I don't care. I mean, I've never cared. I really don't care. But I think about that and I go, okay, and this is a good parallel for private practice physicians, because I hear a lot from them. They say, Dutch, Chuck, David, Byron, and a couple other guys, I just want to make money from being a good doctor.
Right.
And I go, well, that ship sailed. Like, you're dreaming in nostalgia land. It's like United Healthcare or any buka saying, we'd like to make money from self-funded plans.
Right.
That ship sailed, pal.
Right.
That's over.
Right.
Right now, this summer when I got to hear Eric Bricker speak, he was fantastic.
Yeah.
I wanted everyone in the world to hear that speech that he did. It was really like, the carriers are PBMs and they're Medicare Advantage.
That's it.
And the carriers are happy to say to a hospital like our dopey hospital here in town, hey, we'll give you 300% of Medicare for the self-funded plans on the ASO side,
Mm-hmm.
but we want 85% of Medicare on the Medicare Advantage side. Like, we got to make this deal work, and we're at risk on the Medicare, on the capitation.
Right.
But passing expenses on to employers, that's no big deal for us. Like, we don't care.
Yeah, I mean, it's basically a single sheet financial transaction. If you think there's really not much thought, we're gonna load up over here and win over there.
Win over there. Yeah, and it works for the health systems, right?
Right.
Because they're like, "Hey, I gotta make $500 million this year or $1 billion. You're my best buddy at the carrier."
Right.
Like,
What's it gonna be?
yeah.
Like,
And then we go play some golf, get on our yacht, and look at our car collection.
here locally, it's so funny. Like every 5-6 years
Oh, yeah.
in the public, there's this huge fight
Ah!
between Blue Cross
And the other one?
and our Saint so and so
Yeah.
here in town, and it's so fake. It's not even funny. Like you're just lying to the people. You guys are colluding. You're coming up with you know exactly where you're gonna land.
Yeah.
You're just acting like you're fighting for
Do you
position.
think when the health systems do you think when the health systems, the carriers, do you, like, sometimes see them sitting in a room going like, "Hey, let's put out a big press release in our favorite newspaper because 'cause they'll print whatever we want anyway."
Because we advertise
Yeah,
them all the time.
because we own the advertising budget.
Mm-hmm.
I mean, I noticed that in Arizona, like, they'd never say anything about Banner, like the big nonprofit. And after a couple of years, it hit me. I started looking at all the ads and I was like, "Oh, I see how this works."
Ads are payoffs, baby.